Penguin Random House Audio presents The Acid Watcher Diet, a 28-day reflux prevention and healing program. This is the author, Dr. Jonathan Aviv. Publisher's note: the information contained in this book is for informational purposes only. It is not intended as a substitute for the advice and care of your physician, and you should use proper discretion in consultation with your physician in utilizing the information presented. The author and publisher expressly disclaim responsibility for any adverse effects that may result from the use or application of the information contained in the book. Note to listeners: this program includes a downloadable PDF that contains diagrams, food lists, shopping lists, recipes, meal plans, HIIT exercises, menus, and additional reading from the book. To Kaylee, Nikki, and Blake for their love and support. Quality is not an act, it is a habit. Aristotle. Introduction. Amber, a 37-year-old work-at-home mom, is very worried because for the past 7 months she has felt a lump-like sensation in her throat. She has difficulty swallowing solid foods, and sometimes even pills seem to get stuck in her throat. Her voice is strained, occasionally raspy, and she feels thick mucus in her throat and a postnasal drip. She's constantly clearing her throat, day and night. She saw her primary doctor, who started her on some allergy medications, but her complaints persisted. Amber confided her concerns to a friend who had similar symptoms and suggested that Amber see an ear, nose, and throat ENT doctor. She was ultimately referred to me, and when I saw Amber in my office, I first asked her about her diet and lifestyle. She started every morning with the first of 3 cups of coffee and a glass of either orange juice or grapefruit juice. Lunch typically was some sort of tomato-based salad with a lemon vinaigrette dressing. Family dinner during the work week was at 6:30 p.m., when she had 1 or 2 glasses of wine at dinner. Generally, around 10 p.m., she had a snack of a chocolate square or 2 with a cup of herbal tea. Examination of her throat with a small camera showed that the normally thin, vibrating vocal cords were swollen like kielbasa, and there was a great deal of swelling in the back of the larynx, in the area where the esophagus begins. As the clinical director of the Voice and Swallowing Center at ENT and Allergy Associates in New York City, I see patients like Amber every day, people who have acid reflux disease, but who break the mold for what used to be considered the typical acid-damaged individual. If you've ever seen Alka-Seltzer commercials from the 1970s and 1980s, you know what I mean. To have acid reflux, you had to be a white, overweight, middle-aged man who had just overindulged in burgers, pizza, and meatballs and was complaining of heartburn. Today, acid damage is a more universal problem. It doesn't just manifest itself in heartburn, and it afflicts people of all races and ages, including the very young. It keeps both men and women up at night and clearing their throats all day. What's also changed is the definition of acid damage. You were once thought to be dealing with excess acid only if you demonstrated the classic symptom of heartburn, which, despite its name, is caused by the regurgitation of stomach acid into its adjacent organ to the north, the esophagus, not the heart. But as you'll discover in the Acid Watcher Diet, this is a narrow, misleading, and in some instances dangerous definition. In addition to heartburn, the symptoms of acid damage can include the following: hoarseness, a chronic nagging cough, a sore throat that appears out of nowhere, a feeling of a lump being stuck in your throat. Postnasal drip. Allergies. Shortness of breath. Abdominal bloating. These symptoms may be present with or without heartburn or indigestion. For this reason, millions of people with acid reflux are going undiagnosed and putting themselves at risk of long-term side effects and potentially deadly diseases, including cancer. More alarming than the evolving demographic of the acid-injured, the expanding list of symptoms, and the seriousness of potential consequences is the sheer number of people affected. At least 60 million Americans have acid reflux disease, the most common of acid-related disorders. This is more than the number of people affected by heart disease, diabetes, and celiac disease. And a growing number are succumbing to esophageal cancer, the most extreme manifestation of acid damage. Esophageal cancer has seen a 650-fold increase since the 1970s and is poised to replace colon cancer as the second most common cancer in the United States. Interestingly, the rise in esophageal cancer occurred over the same period that the battle against other forms of cancer, including breast cancer, had made great strides. There are a number of possible contributing factors to the astounding increase in cases of esophageal cancer. Delayed treatment. Too many people tolerate the inconvenience of reflux-related symptoms for years, letting acid damage go unchecked. Because of a misunderstanding of symptoms, they may not even know that acid is to blame. For example, did you know that acid reflux disease is the most common non-lung, non-allergy cause of chronic cough? Incorrect treatment. When it comes to excess acid, solutions based on pseudoscience abound, including the use of pH value, acidic versus alkaline, to distinguish healthy from non-healthy foods. Some of these supposed solutions, especially dietary, not only are ineffective but can dangerously worsen acid damage and pave the way for precancerous conditions to develop. Missed diagnoses. Many healthcare professionals are often perplexed by reflux symptoms. Are your symptoms due to allergies or a lung or digestive issue? And to which type of doctor would you be sent first? Many of my patients have seen multiple doctors and have been seeking the right treatment for years before they land in my office. Meanwhile, their acid reflux has continued on unchecked. Misuse of and/or over-reliance on acid-blocking medications. A significant percentage of people who've been prescribed antacid medication do not follow the medication's instructions to a T, a strict requirement for it to be fully effective. The other issue with medications such as proton pump inhibitors, PPIs, which can play a critical role in treating acid reflux when prescribed and taken correctly, is that many people continue to ingest acidic foods and beverages, thereby letting the acid damage continue despite a lessening of symptoms. Still, these issues don't get to the origin of acid damage. They don't answer the question of why so many of us are plagued by acid reflux and its attendant symptoms in the first place. To answer that, we have to look at the foods and beverages we eat and drink every day. That's where we'll find the one component that's doing all the damage: dietary acid. Whether you know it or not, dietary acid is lurking in many of the foods we consume and presumed to be harmless. And this brings me to why I've written this book. We are at a critical tipping point concerning acid-related disease. We can no longer continue to ingest with every meal the excess of acid that our foods and beverages contain, nor can we continue to indulge in foods that contain chemicals that alter the natural antacid protective barriers that our bodies already have in place. and we can't settle for subpar or outdated treatment.
Sample complete. Ready to continue?